Cancer cases and deaths among men are expected to nearly double by 2050.
And a new study published in the journal Cancer says seniors and those living in lower developed countries will bear the brunt of those increases. UW Health's Dr. Jeff Pothof is here for his weekly visit. Hi, Dr. Pothof.
Hey, guys.
Hello.
Well, this is sort of a sobering study.
Yeah, I mean, the numbers are pretty extreme, 93% increase in deaths and things like that. I think there's a few things when you look at this study, large study, that are driving that. One is that there's just more humans. There's more humans that are aging, and that results in more cancer deaths. So that one's kind of like maybe a little sigh of relief. But the other one's not so much. There's two big things that men do that women apparently do less of. One, we don't get screened for cancers at as good of a rate. I think, and I kind of feel this, we feel a little bit invincible. We don't think that this can happen to us. So things that are a little inconvenience, like maybe getting colorectal cancer screening or prostate screening, we just don't do those things. That gets us in trouble. The other thing is we are more likely to participate in what's called modifiable risk factors. Two things that we know significantly increase our risk for cancer is consuming alcohol and smoking. And men tend to do that at much higher rates than, say, women do. All these things together makes the future not look so rosy for men as it relates to their cancer risk.
So for men out there who think, I don't need to go to the doctor, I'll get over this, like that can be a life or death thing. They don't listen to their bodies. You're
right, and we do this all the time. I think we underappreciate the risk that is there, thinking that this won't possibly happen to me. It seems rare. And then if you wait, then you're diagnosed at a much later stage. There's regret, like, oh man, I shouldn't have done that. But in real life, there aren't do-overs. That's just the way that it is.
This study also looked at types of cancer. Lung cancer in particular, they're predicting is going to increase dramatically.
Yeah, lung cancer was by far the winner across most of the world. There's some countries where other things kind of pop up. As the age gets older, prostate cancer starts to come up. I think the other thing that was really interesting is they looked at the Human Development Index, which is a United Nations score that looks at life expectancy, educational level, and then per capita income. And if you take countries that do much more poorly in that, 2.5 greater time increase in cancer than, say, countries who do better, say Europe, with just a 50% increase in cancer risk.
That's something to think about. Does it affect generations differently?
So there are studies that suggest, and this is not good news, but Gen X's and millennials are also maybe at a little bit higher risk for cancer. A different study, but again, these risk factors, both maybe not so much tobacco and alcohol, but sometimes our dietary choices. The rate of obesity has gone up quite a bit, especially in developed countries like the United States. And then likewise, that same attitude of like, well, it's just not going to happen to me. Those individuals tend to be a little bit on the younger side too in those generations. And we also see cancers sneaking up on those individuals.
So the biggest takeaway, would you say, is that men need to do routine screenings?
Yeah,
I mean, I don't know how do you convince you guys to do this? I mean, I think every woman watching is wondering the same thing.
Yeah, it really is true. People have to pay attention to what's going on, and it's...
Maybe because is it that you think, if I don't know, it can't hurt me?
Yeah, there's probably some of that, but I think it's get screened. And these things that you can control, diet, tobacco, and alcohol, maybe exercise, put that in there, you can make a big impact in that way.
Yeah. Go to the doctor if you can.
There you go. That's the message. All right, Dr. Pothof, good to see you. Thank you.